Up to 40% of hospitalized adults have impaired cognition and require the assistance of a family member or other surrogate to make medical decisions, according to an article in the Journal of Geriatric Medicine called Communicating with Clinicians. If you work in a hospital, does this statistic surprise you? Taking this a step further, if hospitalized older adults frequently are transferred to skilled nursing communities or assisted living communities, do staff in these settings recognize communication to be a challenge? As a care advocate, I frequently become involved in situations where family caregivers express frustration because hospital or community staff are not communicating appropriately. By appropriate communication, I mean that family caregivers do not comprehend the consequences of information provided. Family is too overwhelmed to hear what was communicated, and even if information is communicated to family caregivers or the individual needing care, there is little understanding of the significance of the information and how this relates to the reality or practicality of care. Little information provided by professional caregivers is understood by family members or individuals under stress. Let me give you an example. A doctor reviews a blood test result and says, "Mrs. B, your BMP indicates that you have high creatinine level and we're seeing protein significantly higher than normal." Mrs. B listens. The doctor fails to make a recommendation or explain next steps and keeps flipping through Mrs. B's chart. Does Mrs. B understand that her liver condition is significantly affecting her kidneys? Does Mrs. B have the cognitive ability to ask a question? Will the doctor assume Mrs. B understands the information communicated and assume she agrees to begin treatment? Place any person in a situation of unfamiliarity. Introduce technical information, and there is likely to be a communication glitch. If your auto mechanic starts talking about transmission fluids and timing belt replacement, do you ask questions or agree to the repairs? If a financial planner talked about puts and calls, would you nod your head or ask a question? How might professional caregivers work to improve the quality of communication with family caregivers when there's so little time available for communication? Research indicates family caregivers desire frequent contact, a high degree of ongoing information, and emotional support. In hospital and emergency room situations, this is rarely possible. In situations where loved ones live in care communities, based on the number of residents and available staff, this also may not be possible. If you have families you view as demanding or needy, or who consume a significant amount of your staff's time, refer the family to a care advocate or care manager who is able to provide support, information, education, and emotional support. This recommendation will allow your staff to return to focusing on the provision of care and will provide the family with a personal advocate, able to respond to questions, address concerns, and provide emotional support. The involvement of a care advocate offers additional benefits. For example, care oversight to reduce hospital readmissions and communication with community staff to manage care situations so that families do not require a high degree of ongoing information and emotional support from your staff. I'm Pamela Wilson of the Caring Generation, an online community of support for professional and family caregivers.